So today I'm going to be discussing the effects that COVID has had on hearing devices and our hearing. We've been dealing with COVID for the past year now, if you can believe that. So have some information. One of the first things that I want to just discuss is, does COVID cause hearing loss? That's a question that I think a lot of people are concerned about. If you either get COVID or if you get the vaccine, is it going to affect your hearing? Viruses are known to cause hearing loss in some cases. So it's certainly not something that we can rule out, or if you get COVID, we do want to take it seriously. However, there have not been any specific scientific evidence showing correlation between COVID and hearing loss. There have been some anecdotal reports, and then there also have been some cases of increased tinnitus after receiving the vaccine. I know myself personally, I did have both vaccine shots, and I did have an increase in tinnitus for about 2 weeks after the second dose, and that seems to be pretty consistent with what other people have experienced as well. The good news is that most of these symptoms are temporary, so it's really not something that we need to be concerned about as far as overall hearing loss. However, people come in every day and have questions and comments about masks, social distancing, wearing the hearing aids. There's a lot of thoughts and input about those things. So today I want to talk about some of the more common ones and go over some of the typical sort of complaints and some of the solutions that we found. So masks are probably one of the most frustrating parts of COVID, right? We all kind of hate wearing the masks. One of the things that you can do is try wearing a clear mask. Or a different type of mask that can help with you being able to see visuals. That's probably the biggest complaint, is people are coming in and saying, I didn't realize how much I relied on reading lips. We don't necessarily all read lips, but we do watch for visual cues. We look at people's faces and their facial expressions, and it makes a big difference for our brain's ability to help filter and help process additional information, especially if we're having trouble hearing. Watching our faces can really add to that. So the mask can really hinder it in that way. But we can still watch people's eyes and body language, pay attention to context clues so you know the topic of conversation and can follow the process of the conversation as well. So even with the masks, there are still ways that we can help with using those visual cues. And the other thing is, because we're not able to use those visual cues and because our clarity is maybe muffled, we need a little bit more time to process information. So giving yourself just a little extra time can be really beneficial. And of course, things like reducing background noise and additional distractions, that's part of good communication strategies anyway. So that's going to be especially important when people are wearing masks or speaking from a further distance. Depending on the type of hearing devices you have, the technology available to you, there are some specific ways that masks affect hearing, certain frequencies that we know are bothered by masks. And so depending on your hearing devices, there are some adjustments that we can make to the program settings to help compensate for some of those changes and improve the clarity. So you can definitely talk to your provider about what options might be available for you. The next couple of concerns are reduced volume and increased distance. Wearing a mask or speaking from further away can definitely reduce the overall volume that you hear from the speaker. If they are, let's say, doing the 6-foot social distancing and they're not wearing a mask, you may at least be able to see them well and use some of those visual cues. So having good lighting is going to be helpful that you can see their faces well. And again, watching for gestures, body language, hand gestures can also help. Minimizing other distractions and background noise so that it doesn't interfere with the speech that you're trying to listen to. For the speaker, if they can speak clearly and at maybe a more comfortable pace, it's going to help give you a little bit more time to process the information and think about what was said, instead of the words sort of running into each other and becoming more garbled. Depending on your hearing devices, again, if you have volume control options, that can be a really good solution as well. The person is a little further away from you, their voice is going to be a little softer. If you can turn up your hearing devices a couple of steps, that can really help compensate for the distance. Okay, fit problems and loss. This is probably the most frustrating part of the mask wearing, is we put our mask on and now our hearing aids don't fit well. And we have seen a little bit of an increase in people losing their hearing devices, particularly because of masks. So first of all, you need your hearing devices to fit well without the mask on. If you're having issues with the fit when you don't have anything else in your ear, that needs to be addressed first. When you put your mask on, if you're using a mask that goes behind your ear, it may adjust the way the hearing device fits in your ear. So that's sort of the second step. We want a good fit without the mask and a good fit with the mask on. The mask may change the shape and how it fits into your ear. So there are some tricks that we have learned on ways to help improve the retention of the hearing devices in your ear, even with the mask on. Now, this is particularly for people who have hearing devices that go behind the ear, where we see more of these issues. And there are some alternative mask options that can help. So having a mask that doesn't attach behind your ear, but maybe ties behind your head, or using what they call an ear saver, which is like a little extra piece that you wear in the back and attach to the mask, or attaching the mask to your glasses. So there are some different options for types of masks that don't go behind your ear that can help improve the fit so that they're not fighting for space. This is especially important if you also wear glasses or sunglasses. There's only so much room behind your ear. So anything that we can do to improve the space there. It's something to think about if you're thinking about getting new hearing devices or hearing devices for the first time. A custom style or in the ear style hearing device that does not go behind your ear. There are other options other than behind the ear hearing devices. Now, there are some caveats to that, with your hearing being appropriate for the style and the fit and some of the features. So that's something you would need to talk to your provider about. Some hearing devices also have GPS tracking. So if it does come off your ear and you can't find it, some of them allow you to be able to track it. It does have to be connected to smartphone prior to losing it. That's sort of the one main thing, is it's not something you can do after the fact. It has to be done in advance. So again, talk to your provider if that's a feature available to you. A couple of tricks that I have learned are the way you take off your mask and where you take off your mask. So let's say you run to Publix, you have your hearing devices on, your mask is on, you're coming out of the store, you're in the parking lot, and you take your mask off. You drive home and you realize, oh my gosh, I don't have my hearing aid. If you would have waited to take the mask off in the car, then we would know, okay, the hearing aid probably fell off in the car. If you're doing it while you're walking, it probably fell off in the parking lot. Your chances of finding it or getting it back, although not impossible, especially if you have the GPS tagging, but are much lower. So taking your mask off in a confined space, at home, in the car, someplace where you know that if it falls, you're more likely to get it back, is actually a really good tip. And then just being really cognizant of how you take your mask off, being gentle with it, checking to make sure the hearing device is still in place. It does take a little bit more effort and maybe a little bit more time, but it'll be beneficial in the long run. If you notice a change in your hearing, if you are feeling like their hearing is not fitting properly, or if you feel like you're still struggling even after using some of these tips that we've talked about, I would recommend having an appointment with your provider to see what other changes we can make. Again, using some program changes or adjusting your settings or going over some tips on making sure that they fit properly will be really important. It's also important to use really good communication strategies. I know I didn't get into that today, but there is another class on good communication strategies. And I think that's more important now than ever, just because we need both ourselves and the people we talk to use those good strategies. Be aware of your hearing devices, especially when wearing the mask. I know the goal is sort of to put them on and forget about them, but we can't forget about them completely to the point where if they fall off, we don't notice. So if you're not hearing a big difference when you put the hearing devices in, or you can't tell if they're in properly, those are things to definitely talk to your provider about. And last kind of takeaway that I have is just be patient with yourself and with others. Hopefully COVID is temporary. I think we'll be getting rid of the masks in the near future. So this isn't something that, hopefully we'll have to deal with long term. But regardless of your hearing level, everyone is kind of struggling with the clarity. Even if you have perfect hearing, the masks still muffle people's voices. So we're all going through some of that same process. And it's definitely harder if we have some hearing loss or if we're having issues with our hearing devices, but we're all in this together. So just be patient with yourself. Give yourself extra time to process and to communicate and to practice some of these strategies. And just remember that everyone is sort of going through this together. I would like to spend some time answering questions or maybe talking about ideas, tips that you have that have worked really well for you. I would like to keep it somewhat on topic. So I'm going to stop sharing the screen and we'll open the floor for questions. Okay. If you have a question, you can go ahead and unmute yourself and go ahead and ask away. Are there any questions?